to Al Jazeera America. America's top law enforcement officials say that heroin and other opiates are killing more people in some communities than violent crime and car crashes. At a first of its kind summit, they gathered in Washington, D.C. to talk about the widespread abuse of the drug and the lethal consequences. Take a look at these numbers here. Between 2006 and 2010, deaths from heroin overdose jumped 45% since 2011. The Drug Enforcement Agency has opened 4,500 heroin-related investigations. Roxana Saberi is here, and you're following all of the numbers and some of the personal stories connected to this.
That's right, Tony. Heroin used to be popular in the 1950s and 60s, but now Attorney General Eric Holder says that the heroin threat is again kind of sneaking up on us, and that's partly because heroin is becoming purer and stronger. And a lot of heroin users are inexperienced. That increases their chances of overdosing.
It's that same passion that convinced Will to try heroin. He was found dead the morning of March 23rd. From a heroin overdose.
These are the words of a father who lost his son to heroin overdose in Vermont. But the drug that's known as black tar or smack is taking lives in communities across the U.S. It's creating what America's top law officer calls a problem for all Americans.
This is a national issue. It is not regional. It's not state. It's not a section of the country. This is a problem national in scope.
Seizures of heroin in America are up nearly 90% over the past 4 years. The most recent on Wednesday in New York, where police found 24 pounds of heroin hidden in a kitchen cabinet. Heroin is now the second greatest drug risk in the U.S. after methamphetamine, and it's getting easier to find in almost every region, flowing in from Mexico and South America. It's the most available in the Northeast and finding new markets in the Midwest. It's also relatively cheap, from $4 a bag in some places to $20 in others. That and its potency have convinced some prescription drug addicts to switch over. Authorities say many of those inexperienced users are at a greater risk of overdosing and death.
There has to be a law enforcement response to this, but I think we also have to make sure that we think of this as a public health issue as well, and bring to bear all the forces of government in educating, preventing, treating, and then holding accountable those who would engage in the drug trade of this very dangerous substance.
The DEA says more heroin abusers are starting at a younger age. A few years ago, the average age of first-time users was around 25 and a half, and now it's 22. And Tony, 17 states plus the District of Columbia have taken steps to increase access to the drug naloxone. It can reverse the effects of a heroin overdose and also help restore breathing.
Naloxone.
Naloxone.
Okay, all right. I want to dive into this a little deeper. Roxanne, appreciate it. Thank you.
You're welcome.
Joining me now to discuss this is Joe Schrank. He is the founder of Rebound Brooklyn. That is a treatment center in New York City. Joe, good to see you again. Look, the Attorney General is calling the stunning rise in heroin and prescription opiate overdose deaths one of the most urgent and complex challenges facing public safety professionals in the country. Any hype to that statement, or does he have it calibrated just right?
He has it calibrated just right. I think that if it's there are more overdoses than car accidents. Certainly most people have unfortunately experienced the death of somebody they know by a car accident. So if you put it in context of how common it's becoming, he's not really overstating the problem at all.
Okay, so what has been done over the years here about the pharmacists? Let's start there, who knowingly fill these bad prescriptions. What's being done to shut down these pill mills?
Unfortunately, there's not enough being done. Lots of, it starts with medical schools. The education for doctors in terms of addiction is very minimal. They don't screen for addiction. They don't necessarily know what to look for. And so it does set people up for accessing these drugs inappropriately and abusing them.
It's interesting. We've heard anecdotally and seen some evidence that there's been an effort to crack down on the pill mills, but hasn't that led to more addicts turning to the cheaper and more widely available heroin, and what's being done about that?
Well, look, I mean, absolutely. If people are addicted to opiates, they will do whatever it takes. If it takes going to the dealer for heroin rather than to going to the doctor or the pharmacy, they'll absolutely do it. You know, one of the things I think that's really interesting that Eric Holder said is that naloxone should be widely spread. Nobody can receive treatment or find recovery if they're dead. It doesn't make any sense to not have that as a safety precaution. It's also interesting that our drug policy in America is still done by the Criminal Justice Department. He's an attorney. He's not a doctor. He's not a social worker. He's giving this policy, which is really a harm reduction policy, which has traditionally been popular in Europe and Canada, but not in the United States. Our method has always been incarceration and punishment, and this is where it's gotten us. So it probably is time for harm reduction. I don't know if the American culture is quite ready for it yet.
Well, wait a minute here, Joe. We've got this other argument out there that says that the widespread use of naloxone takes away the fear of death from addicts and will actually cause more usage.
That's utter nonsense. That's like saying, "Oh, don't get a fire extinguisher in your kitchen because you'll probably cause a kitchen fire." There is no scholarly research to support that position at all.
So how much of the answer to getting a handle on this problem, forget about solving it at this point, right? Is tied to increasing support for education, prevention, and treatment?
Treatment and prevention, absolutely. Education, I'm not a huge advocate. I mean, how long does it take to educate somebody that drugs are bad?
Right.
Preventative measures and treatment are what's needed, in my view. I think that we've tried so many other things, and we have not tried that. Recovery works, treatment works, it's possible. Addiction is a health issue. We don't incarcerate diabetics for eating candy, and we shouldn't incarcerate addicts for using heroin. It makes no sense. So with the combination of the Good Samaritan laws and naloxone, we can save a lot of lives, engage these people in treatment, and help them all have happy and productive lives, helping their families and themselves and the community.
Before I let you go, Joe, take a moment here and describe for everyone watching just how bad this abuse is, this cycle of using these opiates and heroin, how life-consuming it can become, and how hard it is to put it down and walk away, to simply quit.
It's impossible. There's no way that people can just stop. Once they're addicted, there's no way that they can stop without help. There are lots of people out there who say you can white knuckle it, or if you go to 12-step meetings, or it's a spiritual thing. The truth is, all of the evidence suggests that it's a medical issue that requires medical treatment, which is one of the things that we are very big advocates at Rebound Brooklyn. We have a physician on staff for this reason. Medication-assisted recovery is valid, and it can help. People cannot self-will this. Absolutely not.
Joe, appreciate your time. Good to see you again.
Thank you so much.
Schrank. He is the founder of Rebound Brooklyn, as he just mentioned. That is a treatment center in New York City. Well, there